Welcome from Lugano, where I am at the International Lymphoma Conference. So I gave a talk this morning about updates on mantle cell lymphoma. There's going to be some more data later in the week, which is a bit early, but broadly speaking, the impact of the BTK inhibitors is what it's all about. Certainly in a relapse setting, these drugs are becoming standard of care really in first relapse. That's certainly the case in the UK and other countries as well. And it's very difficult to see a place where you wouldn't want to use these drugs at first relapse these days. We recognise this bad group with P53 mutation, where BTK inhibitors don't work very well, and combinations perhaps overcoming that. The combination of ibrutinib plus venetoclax looks particularly exciting there. We're going to see some data over later on today of the combination of ibrutinib and rituximab frontline in elderly patients, and the results look very good. I can't say specifically what they are just yet because I haven't seen the data, but that just goes to encourage recruitment into the trial we're running in the UK, which is basically that, ibrutinib rituximab versus standard of care chemotherapy, and we've got well over 200 patients now. So I think over the next year or so we're going to see a challenge to conventional chemotherapy. We're going to see increasing use of ibrutinib or other BTK inhibitors, frontline, probably in combination with an antibody, maybe with chemotherapy, and certainly the emergence of venetoclax in combination as well. So it's an exciting time, I think, where, as I said at the Lymphoma Hub meeting last night, I can envisage a chemo-free world probably reasonably soon, where we'll be using combinations of BCL2, BTK, maybe with an antibody, in all patients. And then we'll probably be using an MRD assessment tool, and in a young patient group, if they remain positive, we might be transitioning into cellular therapies like CAR T-cell. In older patients, we might be using MRD negativity as a stopping point. We don't really want to be giving these drugs forever. They have some toxicities, they're expensive, so I think we need to find a way of stopping these drugs and perhaps looking at restarting. Same questions we're asking in CLL, but I think they're just as pertinent in mantle cell lymphoma. So it's an exciting time, and I suspect if we're here in 2 years' time, we'll see more data on chemotherapy-free regimens moving into the front line, and that's very much where I see the future.